Hi, my name is Jennifer LeBranch, and I'm doing a project on the Canadian healthcare system as part of my undergraduate summer studentship with the Faculty of Medicine and Dentistry. This is an outline of what I'll be discussing in my presentation. The government's role in healthcare is divided between the federal and provincial or territorial governments, according to the Canadian Constitution. Roles of the federal government include setting policies like the Canada Health Act, offering financial support to provinces and territories, and providing services to groups of people under its jurisdiction, who include First Nations people living on reserves, the Inuit, people serving in the Canadian Forces, veterans, inmates in federal prisons, and some groups of refugees. On the other hand, the roles of the provincial and territorial governments include to deliver most healthcare services, as well as to determine which services are considered medically necessary services and thus will be funded by that province or territory. The Canada Health Act was first passed in April 1984 and later updated in 1996. There are 5 main principles to the Canada Health Act. The first is public administration. This means that provincial healthcare insurance plans must be non-profit and administered by a public authority accountable to the province or territory's government. Second is comprehensiveness. This means that plans must ensure all services deemed medically necessary, which is determined by the province or territory. Third is universality. This means they must provide insured services to everyone, everywhere. Fourth is portability. Provinces must provide insured health services to its citizens while they are temporarily out of either that province or the country. And fifth is accessibility. They must provide insured individuals with reasonable care without discrimination. And the Canada Health Act applies to any person lawfully entitled to be or to remain in Canada who makes his home and is ordinarily present in the province, but does not include a tourist, a transient, or a visitor to the province. According to a report on national healthcare expenditure trends released in 2013, 30% of Canadian healthcare dollars were being spent on hospitals, 16% on drugs, and 15% on physicians. This slide shows what the projected values were for budget spending on healthcare between provinces. You can see that the northern areas have more money per person spent on healthcare than the other areas of the country. Because Canada has a mixed public and private system, our healthcare funding comes from a few different places. The largest contributor is the provincial government, which is backed by the federal government, and they provide 65.3% of our healthcare funding. Out-of-pocket payments accounts for 14.7% of healthcare funding, and private health insurance plans account for 11.8%. Canadian healthcare is funded both publicly and privately. Public funding comes from Canadian Medicare, while private funding comes from either out-of-pocket payments or through private insurance companies that are paid for by the employer and/or the individual. Certain groups are eligible for coverage of healthcare services that are not normally funded through Medicare. These groups include seniors, children, and low-income residents, and they may be eligible to receive healthcare benefits for prescription drugs, dental care, vision care, and medical equipment. In addition to supplementary services being available to residents through demographic-specific insurance plans, like the Seniors Alberta Blue Cross Plan, there may be additional government programs in place, such as AISH, which stands for Assured Income for the Severely Handicapped, and it's available in Alberta. AISH provides benefits for prescription drugs, essential diabetic supplies, optical benefits, dental benefits, and emergency ambulance services for Alberta residents that are severely handicapped and whose income falls below the limit set by AISH. Now we are going to look at the levels of healthcare delivery within Canada. The first level is primary care, which is the first point of contact for healthcare services. The services include treatment and prevention of common diseases and injuries, basic emergency services, health promotion, palliative care, rehabilitation services, and maternity care. They also provide referrals to other health professionals and services. The second level is secondary care, which includes specialized care in hospitals, long-term care facilities, or in the community. However, this has to be upon referral. The third level is tertiary care, which is care provided by extremely specialized individuals, such as neurosurgeons. And the fourth level of care is quaternary care, which is the most complex level of care and only available at select centers. Around the world, healthcare systems are evolving to allow for more effective coordination of primary care. In Canada, this is done through primary healthcare networks. Specifically, in Alberta, they are referred to as primary care networks, and in Ontario, they are referred to as local health integration networks. Geographic specific networks are important for quality care because different locations have different health needs. Alberta specifically set out goals for its PCNs as being to improve patient access, provide round-the-clock primary care services, increase emphasis on health promotion, disease and injury prevention, care of patients with chronic diseases and medically complex problems, coordinate care, foster team approaches to primary health care delivery. And all of these, although they were set out for Alberta, would be similar for all healthcare networks in Canada. This image shows how Canada ranks compared to the rest of the world in healthcare spending. As of 2011, Canada was spending 11.2% of its GDP on healthcare, placing it in the top 5 countries in the world for healthcare expenditure in proportion to GDP. This image shows how Canada compares to the rest of the world in terms of quality of care. It compares Canada with other OECD member countries, which include countries such as Australia, France, Ireland, Sweden, the United Kingdom, and the United States, among many other countries. When Canada falls above the average OECD country in terms of quality of care, the red dot is above the line. However, when the red dot falls below the line, it means that Canada is falling behind in terms of quality of care. In summary, we looked at the division of healthcare roles between federal and provincial governments, the Canada Health Act, financing, delivery of healthcare services, primary healthcare networks, and how Canada compares to the rest of the world.